Good morning, this is Dr. Aryan Mowlavi coming to you from hidefacademy, doing the 100-day challenge for liposuction. So today's question is, can liposuction cause lymphedema? Well, let's start by defining what lymphedema is. Lymphedema is referring to the lymphatic vascular system. So in our bodies, there's 3 vascular systems that help deliver blood and nutrients and then take the blood that's been used and all the waste products away from the cells. Imagine a freeway system, as you might think. So delivery and then taking back everything: food, nutrients, vitamins, proteins, blood products, oxygen, you name it. So there's 3 systems. One is called the artery, the arterial system that delivers. The next one is called the venous system, or the veins that then exit and take stuff away from the cells. Now, there's a discrepancy between the artery and the vein. So what the artery delivers and what the vein takes back, we lose some of that. It's not 100% efficient. We lose maybe 1 to 5% of the products. So it's not a 1-to-1. And so there's these special vessels called the lymphatic vessels. And these guys, their sole purpose is to now drain the discrepancy between what is delivered and what is taken back. They kind of take back what's left, okay, so that you don't build up that extra 1% to 5% of fluid or whatnot that's left. In addition, the lymphatics deliver the white blood cells. Those are your immune system. So they have kind of 2 functional roles. The lymph vessels drain into these nodal basins called lymph nodes, and that's where the police stations are. And so the white blood cells live there, and they're kind of monitoring your body. If there's anything like that gets into your body that's not supposed to be there, they're the ones that first catch the cue and then tell everybody, hey, we have a problem in so-and-so and so-and-so place. So that is, in a nutshell, what the lymphatic system is about. Now, it so happens that the lymphatic vessels are very, very vulnerable. They're very fragile, and they can tear easily. So the question, does liposuction cause lymphedema, is intuitively a reasonable one, okay? Because you can consider, if you're mechanically traumatizing the soft tissues by trying to get the fat out, in theory, you would think, hey, these little fragile lymphatic systems, the vessels, surely should rip or get damaged or not function. Thus, if the lymphatic vessels don't work, you're going to get swelling and what we call lymphedema. Lymphedema is recognized as swelling of body parts, typically in the limbs, the lower limbs and the upper limbs, when the lymphatic channels aren't working so well. Lymphedema, we see it in two clinical scenarios. One is in patients usually that are more obese and they have poor vascular flow in general in their legs. The legs are the hardest to drain out. You can imagine, because you're dependent and they're in the lowest part of your body, so it's harder for your body to drain those legs properly. So lymphedema is more prone to the lower legs. Now, in addition, there's another scenario clinically where lymphedema can affect the upper extremities, and that's if you have cancer surgery, right? Breast cancer or lung cancer. And sometimes if the cancer penetrates your lymph nodes, remember those are the policing stations, then if those lymph nodes don't have the same capacity for functionality because they've been biopsied or they've been radiated or treated, you can get lymphedema in the upper extremities as well. Now, back to the question, so I don't detour too much, but can liposuction cause lymphedema? What's interesting, you guys, is actually liposuction has been presented as a means of treating lymphedema. So let me kind of try to explain the situation. When you get lymphedema and the fluid and the blood products and whatever and whatnot and waste products start accumulating, they result in soft tissue swelling, which is that lymphedema clinical scenario. And then what happens is you get a little bit of fibrosis and scarring and fatty tissue buildup, and so the whole limb starts swelling. And it's not just fluid, it's just all sorts of stuff. So liposuction has been utilized to actually treat lymphedema, because you can actually go in there and liposuction the heck out of that limb and thin it out, for a lack of a better word. Literally, whatever's in there, the fat, the soft tissue, the scars, etc. Now, Remember, we've talked about this, but there are different modalities of liposuction. You can do the traditional liposuction where you just use the rod, and then you can also do supplemental liposuction where you supplement with energy products to try to make the fat removal more efficient. So in particular, I want to talk to you about ultrasound-assisted liposuction, because this modality has actually definitively been shown to help with lymphedema. And the reason is because the ultrasound, as you guys may remember or know of, what it does is it teases the cells, the fat cells, away from the vital structures such as nerves and vessels. And by doing so, it allows us to more efficiently remove the fat. So we're not as traumatic to the tissues. And in theory, if you're not as traumatic in the soft tissues as you're trying to pry away the fat, you can think that maybe these lymphatic channels have a better chance of not getting irritated and injured. So in a nutshell, lymphedema is definitely not caused by liposuction. And in fact, there are very unique liposuction techniques such as the ultrasound-assisted liposuction that can actually help you with lymphedema. We've had some great success stories to share with you, maybe in future question and answers and topics that we cover in hidefacademy we can cover. But there we have it. Liposuction is definitely not associated with increased vulnerability to lymphedema. Thank you.